Hello, this is my evidence-based practice project focused around fall prevention. It's 1995 and it's 2 a.m. You're sleeping over at your grandparents' house with your cousins. You're all asleep on a pallet in the living room. The yellow glow of the television fills the room. You roll over and you hear an older lady say, "Help, I've fallen and I can't get up." The United States has between 700,000 and 1 million falls in the hospital each year. Most falls during a hospital stay happen in the bathroom or in relation to elimination. Roughly 30% of falls result in serious injury such as a broken hip, a broken arm, or a brain bleed. Other contributing factors include being over the age of 65, confusion or agitation, use of sedatives, opioids, antihypertensives, laxatives, among others, as well as being tethered down by tubes or lines. To help prevent falls, make sure the patient is wearing proper identification, such as the yellow fall risk armband, yellow slipper socks when they are up out of bed. Make sure the call light is within reach, and prior to leaving the room, make sure the bed alarm is on and set to the appropriate sensitivity. Another way to prevent falls is to properly fill out the mobility board that is in each patient's room with the appropriate interventions that each patient requires. With most falls occurring while toileting, it's important to stay within arm's reach of the patient while they are using the restroom until they are back in bed or in the chair. My PICO question states, in patients who are deemed a high fall risk, how does hourly rounding compared to every 2-hour rounding affect the number of falls within a 12-month period? Meeting with Dr. Mark Hayes helped broaden my research, yet filter and hone in on the articles that would be beneficial to my PICO question. I was very familiar with EBSCO as I've used it in my undergrad and during this entire program, but I wasn't so much familiar with ProQuest, and then the Mendeley software absolutely blew me away. The Mendeley program was extremely helpful to organize my data that I used for this assignment. However, it would have been extremely beneficial to be aware of this software at the beginning of the program. There have been many times where I have wanted to reuse or cite a journal or an article that I've used in a previous class, but I'm not able to find it. Here is the EBSCO search that Dr. Hayes and I worked on that resulted in over 8,000 peer-reviewed articles over the last 5 years. But when we took this information and plugged it into ProQuest and then added the filters of meta-analysis, systematic review, or randomized control trial, that then brought the results down to 128 articles. One article I reviewed showed that intentional rounding helps decrease some adverse events, but did not have any effect on the number of falls that happened across the studied units. This study or this article focused primarily on ICU level care, so they were more focused on unplanned extubations versus a patient falling. Another article that was reviewed did support my PICO question in stating that intentional frequent rounding helps reduce the number of falls and also helps identify risks or needs before they become an issue, such as the patient needing to go to the bathroom or the call light not being within reach or the patient needing something out of their belongings bag. A third article reviewed also supported my PICO question, stating that increased rounding, among other interventions, helped prevent patients from falling while hospitalized. This study's level of evidence was a level 1, so it was pretty low. That was because it was a meta-level analysis, so they took a bunch of different studies and kind of combined them and made it their own article. The outcome I hope to obtain is that with increased rounding by nursing and support staff, the number of falls would decrease over a 12-month period of time. It would be evident if the intervention worked, if there is a decrease in the number of falls. The goal is that within the first 4 months of the new implementation, falls would be down 30%, and by the end of the 12-month study, falls would be reduced by 70%. As nice as it sounds, it's not realistic, unfortunately, to have falls reduced by 100%. The evidence-based practice model that best supports my intervention is the Iowa model of evidence-based practice. The problem focused trigger would be falls, which does align with the healthcare organization's priorities of patient safety and patient satisfaction. Plenty of literature does support this intervention being put in place. Most evidence of literature that's already published is a level 4 or greater, which is high quality. And then for decision making, nursing and support staff on certain units will implement the practice changes, make tweaks, and then once that trial period is over, and they kind of more fine-tune the interventions, all the changes will then be initiated throughout all the units in the health system. This is highly sustainable and will continue to improve patient outcomes and also satisfaction scores. This project helps promote quality and enhance healthcare delivery by using evidence from studies from around the world and also our own to better our practices as healthcare workers. I feel like what I have learned in this class, and specifically with this assignment, will come in very handy with my final 2 classes in this program, which are based on evidence-based practices. And then the quote that I'm going to end with is from one of my favorite shows, The Pitt. Dr. Collins from season 1 said, "Listen to your patient, that is your superpower." This quote stuck with me, and I hope that you are able to find meaning in it as well. There's my references. Thank you.